All right, let's talk about a part of the human body that is just surrounded by myths and a ton of misunderstanding, the hymen. We're going to cut through all that noise today and just look at the scientific facts. Okay, so let's dive right in. What are we actually talking about here? Scientifically speaking, the hymen is just a thin piece of tissue, specifically mucosal tissue, that sits right at the opening of the vagina. You can think of it as part of the vulva, kind of like a border between the outside world and the internal anatomy. So what's it made of? Well, it's mostly elastic connective tissue. It's packed with collagen and elastic fibers, and that's what gives it the ability to stretch. It's also vascularized, meaning it has blood vessels, and it's innervated, which means it has nerves. Now, that combination is why it can sometimes bleed or cause pain if it tears. But, and this is a big but, that experience is definitely not a given for everyone. And here's something that's absolutely crucial to understand. The hymen isn't some fixed, unchanging thing. It's actually a really dynamic piece of tissue that changes pretty dramatically throughout a person's life. This whole journey is tied directly to hormones. At birth, it's actually pretty thick because of all the maternal hormones in a baby's system. Then, during childhood, it thins out. When puberty hits, a surge in estrogen makes it thicker and way more elastic. And then, much later in life, as estrogen levels drop during menopause, it thins out again. So, does everyone's hymen look the same? The answer is a huge, resounding no. When we're talking about the hymen, variation isn't just common, it's pretty much the absolute standard. And this is probably the most important takeaway. There is no single normal or intact appearance. I mean, medical science is crystal clear on this. Diversity in its shape and form is the rule, not the exception. And that one fact, all on its own, really challenges a lot of the cultural ideas out there. Okay, so let's look at some of these shapes. The most common one is called the annular hymen. Just think of a donut or a circle. That opening right in the middle is what allows menstrual blood to flow out, and it's the shape that a lot of people mistakenly believe is the only one. Coming in at a close second for the most common type is the crescent-shaped hymen, and just like the name suggests, it's shaped like a crescent moon. The tissue usually just covers the bottom portion of the vaginal opening, which leaves the top part more open. Now we're getting into some of the rarer variations. On the left, you've got the cribriform hymen, which has a bunch of tiny little holes, almost like a sieve. And on the right is the septate hymen, which has this extra band of tissue running right down the middle, which basically creates two openings instead of one. And the variety just keeps on coming. A fimbriated hymen has these little fringe-like, uneven edges. It's a completely healthy and normal variation, not a sign that anything's torn. Then there's the microperforate hymen. In this case, the tissue covers almost the entire opening, leaving just a tiny pinhole, which can sometimes make things like menstruation a bit difficult. Now, in some very rare cases, we're talking about 1 in 1,000 people, an individual is born with what's called an imperforate hymen. And this means the tissue completely, and I mean completely, covers the vaginal opening. So, this condition is a real medical issue. You usually find out about it when a teenager starts puberty. They'll experience the monthly symptoms, but no period actually happens because the blood can't get out. It gets trapped, and that causes a lot of cyclical pain. This is a situation that requires a minor surgery to correct. So, after seeing all this incredible variation, the question that just pops into your head is, why? I mean, what is the biological point of all this? Yeah, exactly. Does this piece of tissue actually do anything? Does it have a job? Well, the scientific consensus on this is actually really clear, and it might surprise you. The hymen has no known physiological function after birth. It's widely considered to be vestigial, which is just a scientific way of saying it's an evolutionary leftover from how the vagina forms in an embryo. Now, there is one theory that gets thrown around. Some scientists suggest it might offer a little bit of protection against bacteria for infants. But here's the thing, that's just a hypothesis. It's not a proven, definite function. And after infancy, it really doesn't seem to serve any purpose at all. And this data right here really shows the huge gap between the myth and the reality. The common belief is that the hymen always tears and bleeds during first intercourse, right? But in the real world, it's pretty much a coin flip. Look at the numbers. Studies show that only about half of women experience any pain or bleeding at all. The other half, nothing. So let's just wrap this all up. What are the key things to remember? 1, the hymen is a super variable tissue that is constantly changing. 2, there are tons of different shapes, and that diversity is what's normal. 3, it has no known biological function in adults. And 4, because of all that, its appearance just isn't a reliable indicator of, well, of anything about a person's life or history.
And that really leaves us with one last big thought to chew on. We've seen the science. We've seen the clear biological evidence that there is no single standard for what a hymen is supposed to look like. So the question is, why do all these cultural myths about one single intact norm hang around? Understanding the science, well, that's just the first step.